Now, how about the view of Asians and Americans on healthcare services? Do both visit the doctor frequently, or do they pay a visit only when it's absolutely necessary? An article by Annalisa Merrily stated that Asians strive to become doctors but do not want to see them. Especially when it comes to mental health illness, Asians are less likely to visit a doctor regarding their concern, as it was deemed a taboo topic in their society. Asian families have always instilled in their children that they should be clever, hardworking, and in complete control of their lives. Acknowledging weaknesses, such as mental illnesses, would be seen as something to be ashamed of by many. On the other hand, a total of 87% of American adults agreed that having a mental health disorder is nothing to be ashamed of. Although there are some Americans who still hesitate to go to the doctor, they are more likely to pay a visit for prevention purposes because some American countries have higher levels of health insurance coverage. In a recent survey by Single Care, 91% of Americans believe that preventive care is important, and only about 25% of their population do not seek healthcare services. This goes to show that the community you're in has a huge impact on a person's perspective on certain circumstances. When healthcare professionals want more individuals to have regular checkups and to be more open in seeking medical attention, then it is a must to treat the patient and not just the problem. Now, let us talk about how Asians and Americans respond to their health concerns. Herbal medicine is an essential component of traditional Chinese medicine. Herbs are recommended holistically based on the patient's specific situation and not only on current symptoms. Herbal medications restore health by restoring the body's natural equilibrium. They are available as tablets, powders, tinctures, and raw herbs to be used internally or as balms to be applied externally. For years, Chinese herbal therapy has been used to treat many medical ailments and as a preventive dietary supplement. In contrast, the biomedical model of medicine and nursing, based on scientific reductionism, is a primary healing system of the dominant culture or group in the United States. White and Black Americans had comparable mean annual total medical care expenditures, physician visits, and inpatient hospital stays. However, whites were marginally more likely than blacks to spend money on medical care and see a doctor over the year. Traditional Asian medicine undoubtedly leaves many questions unanswered, so it seems appropriate to invoke Ben Franklin's caution, "A little learning is a dangerous thing." Becoming thoroughly familiar with the normative cultural values affecting interactions with patients from different cultures is a process that requires time and experience. In comparison, it is more reliable and safe to go to the hospital when feeling abnormalities, like in the American setting. Lastly, let's talk about
Created using Powtoon.